Okay, folks, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. This, again, is for press only. If you're not a member of the press, but you logged in, please log out and you can watch on one of the live streams. Now we're going to turn things over to Mayor Kenny. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everybody. I want to remind folks that the city yesterday launched PHL Rent Assist Phase 4, which is the newest phase of the COVID-19 Emergency Rental and Utility Assistance Program. This program is aimed to help people pay their rent and utilities who have lost income or had an increase in expenses because of COVID-19. We know that tens of thousands of our city's tenants and landlords are suffering because of the pandemic, and we're doing everything we can to help. Since May, the city has put over $65 million into the hands of landlords and tenants to help more than 14,000 households. With this new funding, we can help even more families stay in their homes and even more landlords to afford to pay their bills. Unlike previous phases, we are excited to be able to offer assistance with overdue utility bills in this round. PHDC, the city's housing and community development nonprofit, will continue to administer this program. Landlords and tenants can apply until funds run out. For more information and ways for tenants to apply, please visit phlrentassist.org. or call 311 for assistance. That's phlrentassist.org. More help is on the way, and we will get through this together. I also want to call attention to the deadline for the Pennsylvania COVID-19 Hospitality Industry Recovery Program, known as CHIRP. The deadline for businesses to submit their application is 11:59 on Monday, April 12th, less than a week away. Through the CHIRP program, PIDC and the Commerce Department will distribute $17 million in funding to provide grants of up to $50,000 per eligible business. We don't want businesses to miss out on this significant source of relief. Eligible businesses are encouraged to apply, including restaurants, food trucks, catering companies, small hotels, and bed and breakfast. Businesses can apply at pidcphila.com/chirp. That's pidcphila.gov/chirp. On that website is a list of organizations that can help business owners if they need assistance in filling out their applications. Be sure to apply by Monday, April 12th at 11:59 p.m. to have a chance at this funding. Now I'll turn it over to Dr. Farley.
Thank you very much, Mayor. The rise in the COVID cases we're seeing is continuing, which means we need to continue to wear masks and keep distance from each other, and to get as many people as possible who are over the age of 65 vaccinated now to prevent deaths. Here are the numbers. Since this time yesterday, we've identified 910 new cases of the coronavirus infection diagnosed either by the PCR test or the antigen test. For the past week that ended on April 3rd, we averaged 507 cases per day. And so far, we expect more. And of those people tested, 8.7% tested positive. Compare that to the previous week, there were 511 cases per day, and 7.1% of the tests were positive. And those numbers have roughly doubled in the past 6 weeks. While they've occurred across the entire population, the increases have been greater in younger adults, say people ages 20 to 54. With the increase in cases, we are seeing an increase in people who are being hospitalized and the number of people who are in hospital beds in any given day. As of today, the number of people in hospital beds with COVID is 490 across the city of Philadelphia, and that number is rising. And the hospitals are not under strain yet, but it's something we do need to watch. With deaths, we have 8 new deaths identified from the coronavirus since yesterday, bringing us to a total of 3,293 since the beginning of the epidemic. We've been averaging about 20 to 30 deaths per week in late February and in March. This is a number that we're watching very closely to see if it rises with the increase in cases, or if it doesn't rise, which might be an indication that the vaccination is preventing people from dying, even if it's not preventing the epidemic wave from hitting the city. Let me talk about where we are with vaccination. The supply of doses of vaccine is gradually increasing. Last week, allocated for delivery this week, was about 40,000 first doses of Pfizer and Moderna combined, plus second doses to match that. So getting close to about 80,000 total. And that doesn't count the separate doses that are given to us for the very large vaccination site at the convention center. Now, also last week for distribution this week was a one-time shipment of a relatively large amount of Johnson & Johnson vaccine, 23,500 doses. That vaccine we will mainly use at the type 2 site, that large community site that's going to be at Esperanza that I'll talk about in a minute. Now, we've been told by the federal government that we'll be getting about the same amount of Pfizer and Moderna vaccine for the next 3 weeks, that will be flat. And the amount of Johnson & Johnson vaccine we'll get will be variable. So we're still not getting really much information about what's happening in future weeks. And there's no real promise of a huge increase in vaccine available anytime soon. For the vaccine that is available, we are making it available now at a total of 247 sites across that city. Those are our total enrolled vaccination sites. That number is up from 204 sites 2 weeks ago. And those includes hospitals and clinics and pharmacies. And the biggest increase has been in pharmacies and in outpatient providers, those clinics. We now have a total of 43 independent pharmacies that are enrolled and receiving vaccine. And the administration of the vaccine is now happening really very quickly. For the week that ended on March 28th, we hit a new high of more than 122,000 doses by all healthcare providers in the city combined over that week. A few weeks ago, we were 30,000 doses delivered over a week. Now, for the last week, we have 109,000 doses delivered so far, but our data is incomplete. Now, the 122,000, the peak week, about 40,000 of those were delivered at the convention center. That means that there was a very large increase in other providers as well. As of Monday evening, we reported vaccination of a total of 556,000 people with the first doses and 318,000 people being fully vaccinated. Now, many of those people are not Philadelphia residents, but we know that 25% of the Philadelphia residents have had at least one dose, and that's an underestimate. And here's why we know that. We know that 13.7% in our data of Philadelphia residents are fully vaccinated. But if you go to data provided by the Centers for Disease Control, that's 16.7% fully vaccinated. And the difference there is people who are Philadelphia residents who are vaccinated outside of the city. So our data is incomplete in that. But still, many more people who are unvaccinated than there are vaccinated. And of the people over the age of 65, about 45% have been vaccinated with at least one dose, which means that there still are many people who are over the age of 65 and vulnerable who are unprotected. So we definitely need to boost the numbers of people over 65 who are protected in order to prevent deaths from this epidemic wave. I'm going to talk a little bit about what we're doing in specialized settings. This has been going on for a while, but I haven't talked about this much in previous press conferences. We've been working with a variety of providers to reach people who live in congregate settings and in senior housing settings. That includes places like behavioral health facilities, rehab facilities, substance use treatment facilities, the state licensed personal care homes, group homes for people with intellectual disabilities, recovery homes, homeless shelters, and low-income senior housing. Across all of those, we have identified 418 sites. And the different sorts of providers, pharmacies and other providers that are going and providing vaccination to the sites, as well as our teams. Of those 418 sites, 322 or 77% now have had at least one visit to receive vaccine or are scheduled to be receiving vaccine. And we're systematically going about getting vaccination available to the other sites. I now want to talk about where we are with eligibility. With this increase in vaccine that we'll be able to deliver, we're moving much more quickly than we were before. So as you know, yesterday, we're moving to phase 1C, which makes eligible sanitation workers, maintenance and janitorial workers, utility workers, and postal and package delivery workers. As of next Monday, the 12th, we will expand to all other essential workers that are listed in phase 1C if they cannot work remotely. People who are essential workers who are working remotely may be essential, but they're not exposed, they're not eligible yet. But anybody in a very large category, very long list of essential workers that cannot work remotely will become eligible next Monday. We had a list on our website before of the phase 1C categories. We have expanded that list to be more consistent with who's eligible in the Commonwealth, which is also moving to phase 1C on April 12th. So that list is something we'll post. You have it in our press release, but includes transportation workers, construction and landscape workers, people working in information technology and telecommunications, including members of the press, people in public health, government workers, election workers, social service workers, people in higher education and in finance and legal. Again, the full list is on our website. Now, we're also including in that list, as of Monday, unpaid caregivers of the medically vulnerable populations. This is something we've been requested to do, and the state has had eligible before. People who take care of someone at home, even if they're not necessarily paid to do it, if the person they're taking care of is medically vulnerable, they become eligible on Monday. And we're also going to make eligible anybody who hasn't already become eligible, who is receiving what's referred to as home and community-based services, as defined by the Pennsylvania Department of Human Services. So that's what's happening on Monday. And then on April 19th, we'll be moving into phase 2. That'll be the same time as the Commonwealth moving to on April 19th and many other states, and it's consistent with today's request from the president. So all adults will be eligible in Philadelphia as well as the state of Pennsylvania on April 19th. Now, while all adults are eligible, doesn't mean that everyone is going to be vaccinated all at one time. And so I still want to make sure we focus on getting vaccinated people over the age of 65. The reason, as I said last week, is that more than 80% of the people who die from this infection are over the age of 65. So my message to Philadelphia residents is, if you're over age 65, sign up now and get vaccinated as soon as possible. Don't delay. This epidemic wave is significant. It's easy enough to get appointments right now if you're over 65 at pharmacies, healthcare providers, or our vaccine interest database. I tested it yesterday and verified that it's true. We're asking our vaccination providers to make access even easier for people over the age of 65 with things like fast track or easy access or walk-up access. Several of the federally qualified health centers in the city are providing walk-up access to people over the age of 65, even if they're not already enrolled as a patient. And 3 of the city health centers run by my department will be doing this Wednesdays from 8 a.m. to 4 p.m. starting tomorrow. I'm going to give you 3 different health centers and their addresses. Anybody over the age of 65 can just walk up and be vaccinated. There's Health Center 3 Annex at 4219 Chester Avenue in West Philadelphia, Health Center 5 Annex at 2001 West Burke Street, North Philadelphia, and Health Center 10 at 2230 Cotman Avenue, the East Side Courtyard entrance, and that's in Northeast Philadelphia. Now, let me talk about the larger vaccination sites. The Center City Vaccination Center at the Convention Center has now done 2 weeks of the second doses of the Pfizer vaccine. They have 1 more week to finish with the people who got the initial 3 weeks of Pfizer vaccine. About the middle of next week, that site will switch over and provide Johnson & Johnson vaccine at about 6,000 doses per day. Then there is a new large volume federally supported site that will be starting this Friday. As I mentioned last week, it's at Esperanza in the Hunting Park neighborhood. It's staffed by the Pennsylvania National Guard. This site will start next Friday vaccinating 1,000 people, and then it'll grow over time to vaccinating up to 2,500 people, 6 days per week for 8 weeks. For people who want to be vaccinated there, it'll be available through a combination appointment as well as walk-ins. So if anyone wants to be vaccinated there or wants to be vaccinated anywhere and doesn't know of another site to get it done, should go to our website, www.phila.gov/vaccineinterest, one word. If you don't have internet, call 311 and they'll put you in their database. And then you'll be directed to multiple vaccination opportunities, including the new site at Esperanza, effective as of this weekend. Now, right now, our priority is still for people over the age of 65, but others will be invited soon. In addition to that, there are increasing numbers of pharmacies and hospitals and clinics that have their own online signups. So availability has never been greater, and it's going to continue to increase in coming days. Now let me move on to our safe at home restrictions. With the rising rates, we're still very concerned about that risk, and we're concerned about the rising hospitalizations. The state of Pennsylvania, effective yesterday, is allowing restaurants and bars to increase to 75% capacity. We're not going to allow that to happen in Philadelphia. We're too concerned about the risk in restaurants and bars, which we know are very high-risk settings. We did make one change, or the state made one additional change over the weekend, and that is for office-type workplaces. Before the state's executive order said that people must work from home unless it's impossible to do so. That wording has been changed to people are strongly encouraged to work from home or strongly encouraged to work remotely. So here, likewise, in Philadelphia, we are strongly encouraging people to work remotely if possible. But if they can't do that, it's okay for them to go to the office to work. And we have guidance for how that can be done safely. People are allowed to be working at those work sites up to 2 persons per 1,000 square feet. And everyone has to wear a mask at all times unless they're alone in a separate room. So whenever you're in the same room with somebody else, everybody needs to be wearing a mask. So this is the first step towards getting people back to the office and back towards normal. But it's a small step because their case rates are still quite high. So in general, what do people do now? I want to remind everyone, the epidemic is still here and it's still deadly. Wear a mask, keep your distance, avoid being around others, and as soon as it's your turn, get vaccinated. And all this is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we are going to switch over to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney. Buenas tardes a todos. Quería recordarles que la ciudad lanzó ayer la fase 4 del PHL Rent Assist, la fase más reciente del programa COVID-19 de emergencia de alquiler y asistencia con servicios públicos. Este programa busca ayudar a las personas que hayan perdido ingresos o hayan aumentado sus gastos debido al COVID-19 para así pagar el alquiler y sus servicios públicos. Sabemos que decenas de miles de inquilinos y de propietarios de nuestra ciudad están sufriendo a raíz de la pandemia y estamos haciendo todo lo posible para ayudarlos. Desde mayo, la ciudad ha entregado más de $65 millones a propietarios e inquilinos para ayudar a más de 14,000 hogares. Con esta nueva financiación podemos ayudar a más familias a permanecer en sus hogares y a más propietarios a poder pagar sus cuentas. A diferencia de las fases anteriores, nos emociona poder ofrecer ayuda con el pago de facturas por servicios en esta ronda. PHDC, la organización sin fines de lucro para el desarrollo comunitario y de vivienda de la ciudad, continuará administrando este programa. Los propietarios e inquilinos pueden presentar una solicitud hasta que se agoten los fondos. Para obtener más información y los formularios que los inquilinos pueden presentar en su solicitud, visite phlrentassist.org o llame al 311 para obtener ayuda. Esto es phlrentassist.org. Más ayuda está en camino para superar esto juntos. También quiero llamar la atención sobre la fecha límite para el programa de recuperación de la industria hotelera COVID-19 de Pensilvania, también conocido como CHIRP. El plazo para que las empresas presenten su solicitud es hasta la medianoche del día lunes 12 de abril, es decir, a menos de una semana. A través del programa CHIRP, PIDC y el Departamento de Comercio distribuirán $17 millones en fondos para otorgar subvenciones de hasta $50,000 por negocio que sea elegible. No queremos que las empresas se pierdan esta importante fuente de apoyo. Se anima, por lo tanto, a las empresas elegibles a postularse, incluyendo restaurantes, camiones de comida, empresas de catering, pequeños hoteles y bed and breakfasts. Las empresas pueden presentar su solicitud en pidcphila.com/chirp. Esto es pidcphila.com/chirp. En ese sitio web hay una lista de organizaciones que pueden ayudar a los propietarios de negocios si es que necesitan ayuda para completar sus solicitudes. Así que asegúrese de presentar la solicitud antes del lunes 12 de abril a las 11:59 p.m. para tener la oportunidad de obtener esta financiación. Y estas son las palabras del comisionado de la salud, el Dr. Thomas Farley, para el día 6 de abril del 2021. El recuento de casos continúa aumentando. Es necesario ahora vacunar a la mayor cantidad posible de personas mayores de 65 años para evitar más muertes. Y comenzamos con los números del día de hoy. Hoy tenemos 910 nuevos casos confirmados por la prueba PCR y la prueba de antígenos. Estos se reportaron desde el día de ayer con un total de 126,759 casos. La semana pasada, del 28 de marzo al 3 de abril, el promedio hasta ese momento era de 507 casos diarios detectados por las pruebas PCR y las pruebas de antígenos, con un 8,7% de pruebas positivas. La semana anterior, del 21 al 27 de marzo, el promedio fue de 511 casos por día, con un 7,1% de pruebas positivas. Este número de casos se ha duplicado con respecto a las últimas 6 semanas. El aumento de casos se ha identificado entre adultos jóvenes, entre aquellos que tienen 20 y 54 años de edad. Con respecto a los pacientes hospitalizados, al día de ayer, lunes 5 de abril, 470 pacientes con COVID-19 están internados en hospitales de Filadelfia. Hoy, 490 personas están hospitalizadas por el COVID-19 en Filadelfia. Los hospitales aún no se encuentran en su máxima capacidad. En cuanto a los fallecimientos, para el día de hoy se identificaron 8 muertes por COVID-19 con un total de 3.293 muertes. Se reportaron entre 20 y 30 muertes semanales a finales de febrero y marzo. Vamos a monitorear esta información de cerca para determinar si las muertes aumentan o si la vacunación previene las muertes a medida de que los casos aumentan. En cuanto a la vacunación, reportamos un incremento muy pequeño en las cantidades de dosis asignadas. Tenemos asignadas para su entrega esta semana aproximadamente 40.000 primeras dosis de la vacuna de Pfizer y de Moderna, más que una cantidad similar de segundas dosis, con un total de 80.000 dosis. No estamos contando las dosis asignadas para la clínica de vacunación en nuestro centro de convenciones. También tenemos 23.500 dosis de la vacuna de Johnson & Johnson. Estas dosis se utilizarán en su mayoría en el centro de vacunación ubicado en Esperanza. Nos indicaron que Filadelfia recibirá una dosis similar de las vacunas de Pfizer y de Moderna durante las próximas 3 semanas. El suministro de la vacuna de Johnson & Johnson, sin embargo, será variable. Con respecto a la administración de las vacunas, el proceso de vacunación en Filadelfia está sucediendo rápidamente. La semana pasada, que finalizó el 28 de marzo, alcanzamos un nuevo hito con 122.000 dosis administradas. La semana que finalizó el 4 de abril, tenemos aproximadamente 109.000 dosis administradas, pero estos datos están incompletos. El incremento ha sido en casi todos los proveedores de vacunación. Para el lunes por la tarde, 556.000 personas habían recibido la primera dosis de la vacuna y 318.000 personas estaban ya completamente vacunadas. Sabemos que el 25% de los residentes de Filadelfia han recibido al menos la primera dosis y el 14% están completamente vacunados. El 45% de los residentes mayores de 65 años han recibido al menos la primera dosis. Nosotros tenemos que aumentar la vacunación en las personas mayores de 65 años para prevenir más muertes. ¿Cómo está disponible la vacuna en la actualidad? Ahora tenemos 247 sitios inscritos que están recibiendo vacunas. Teníamos 204 sitios hace solo 2 semanas. Los hospitales, las clínicas comunitarias y las farmacias están funcionando como centros de vacunación. Ahora tenemos también 43 farmacias independientes que están administrando las vacunas. Con respecto a la vacunación en entornos congregados, estamos trabajando con diferentes proveedores para llegar a entornos congregados y viviendas para personas mayores. Estos entornos incluyen centros de salud conductual, de rehabilitación y para el tratamiento por abuso de sustancias. Hay hogares de cuidado con licencia estatal y centros para personas con enfermedades infecciosas, también refugios y viviendas para personas mayores de bajos ingresos. De 418 sitios identificados, 322 o el 77% han recibido la vacuna o están programados para recibirla. Y nosotros continuamos trabajando para cubrir el resto. Con respecto a la elegibilidad, muchas más personas han sido vacunadas ya en Filadelfia y hoy estamos en la fase 1C, en la que se encuentran como prioridad los trabajadores sanitarios de mantenimiento y conserjería, los trabajadores de la oficina de correos y los repartidores de paquetes. A partir del día lunes 12 de abril, la elegibilidad se expandirá a los trabajadores esenciales en la fase 1C si es que no pueden trabajar remotamente. Esta clasificación se expandió para ser más consecuentes con la Mancomunidad de Pensilvania, que está pasando a la fase 1C el día 12 de abril. Esta fase incluye a los trabajadores del sector transporte, construcción y paisajismo, a los trabajadores en telecomunicaciones, incluyendo la prensa, a la salud pública, a los trabajadores gubernamentales y electorales, a los trabajadores sociales, a aquellos en la educación superior, en finanzas y el área legal. La lista completa puede ser encontrada en nuestro sitio web. Este grupo también incluye a los cuidadores de personas médicamente vulnerables, a las personas que reciben servicios en el hogar y la comunidad, según lo define el Departamento de Servicios Humanos de Pensilvania. Filadelfia avanzará a la fase 2 el día 19 de abril, al mismo tiempo que la Mancomunidad y que otros estados, de forma congruente con la solicitud que nos ha hecho el presidente Biden. La vacunación para personas de más de 65 años nos muestra que más del 80% de las muertes han sido en mayores de 65 años. El mensaje para los residentes de Filadelfia es: si usted tiene más de 65 años, por favor, regrese ahora y vacúnese lo antes posible. No se demore. Les pedimos encarecidamente a los proveedores de vacunas que establezcan como prioridad a aquellos que son mayores de 65 años. Estamos ofreciéndoles acceso directo a las vacunas. Muchos centros de salud federalmente calificados están ofreciendo vacunación sin cita a aquellos mayores de 65 años, aunque no sean pacientes de estos centros. Hay 3 centros de salud de la ciudad que están vacunando mayores de 65 años de edad los días miércoles de 8 de la mañana a 4 de la tarde, comenzando el día de mañana en el HC3 Annex, en el 4219 de la avenida Chester, en el oeste de Filadelfia, en el HC5 Annex, en el 2001 de West Burke, en el norte de Filadelfia. También en el Centro de Salud 10, en el 2230 de la calle Codman, en el noreste de Filadelfia. En cuanto a la vacunación en el centro de vacunación de Center City, en el centro de convenciones de la ciudad, se ha administrado las últimas 2 semanas la segunda dosis de la vacuna de Pfizer. Estará funcionando de esta manera por una semana más. A mediados de la semana pasada, pasará a administrar la vacuna de Johnson & Johnson, es decir, la próxima semana, aproximadamente 6,000 dosis diarias. Con respecto al centro de vacunación tipo 2 de FEMA, está pautado comenzar el día viernes 9 de abril. Estará ubicado en Esperanza, en la zona de Hunting Park, en el corazón latino del norte de Filadelfia. Este centro estará apoyado por miembros de la Guardia Nacional. Se espera vacunar a 1,000 personas diariamente, llegando a 2,000 personas por día durante 6 días por 8 semanas. La modalidad será combinada, con cita y sin cita. Más información sobre esto se dará más adelante. ¿Qué deben hacer las personas que quieran vacunarse? Primero, registrar su interés en fila.gov/vaccine interest. Si usted no tiene internet, llame al 311 y le ayudarán con el proceso de registro. También puede hacerlo en español. En este momento, la prioridad es invitar y vacunar a aquellos mayores de 65 años de edad. Si usted tiene menos de 65 años, puede ser que tenga que esperar un poco más. Las farmacias, los hospitales, las clínicas tienen sus propias páginas web para hacer una cita y así poder vacunarse. Con respecto a las restricciones del plan Más Seguro en Casa, estamos cada vez más preocupados por el aumento de las tasas del COVID y el aumento en las hospitalizaciones. Pensilvania ayer le permitió a los restaurantes y a los bares aumentar su capacidad al 75%. Sin embargo, no lo haremos en Filadelfia. Pensilvania también hizo un cambio referente a los trabajadores durante el fin de semana. Debe trabajar de forma remota a menos que sea imposible, se recomienda encarecidamente que trabaje de forma remota. En Filadelfia también se recomienda encarecidamente a las personas que trabajen en forma remota, si es posible. De lo contrario, se permite hasta 2 personas por cada 1,000 pies cuadrados en los lugares de trabajo. Todos deben usar la mascarilla en todo momento, a menos que estén solos en una habitación por separada. Un recordatorio final. La epidemia sigue aquí, sigue creciendo y sigue siendo mortal. Por favor, use su mascarilla, mantenga la distancia, evite estar cerca de otras personas y tan pronto como sea su turno, vacúnese. Solo con nuestro esfuerzo conjunto podremos superar esta pandemia. Muchas gracias.
All right, thank you, Armando, and we apologize for the technical difficulty. Hopefully his audio came through. And we also want to apologize to those watching on PHL Gov TV or on our live streams due to a scheduling issue. We are not able to offer sign language interpretation today, but we do expect to resume that next Tuesday. Today, for our Q&A, we are again joined by Managing Director Tumar Alexander. Because of limited time, only one representative from each media outlet is permitted to ask questions for the first round, and we are limiting that round to the topic of COVID-19. If there is time, we will do a second round, and only at that point will we take questions on other topics, so please hold them. And of course, reporters are asked to limit their questions to 3 or fewer. And with that, we'll go first to Mitch Blocker of NBC 10.
Thank you, Mike. Good afternoon, everyone. Dr. Farley, I'm wondering, can you talk a little bit about how universal vaccine access on April 19th affects city logistics? I'm wondering specifically, how long should people expect to wait between making an appointment and getting a shot?
It's very hard to predict that, Mitch. We know that there are many people who are under the age of 65 who have been eligible because they've been an essential worker. We know there's some people who are not at the moment ready to be vaccinated. So I don't know how much of an increase in interest we're going to get around that time. With the announcement today and the appointment availability, people start contacting people for appointments, and we'll learn. We, in general, at our vaccination sites, we're finding that most of the appointments are filled, but the organizations running them say that they have to work harder than they did before to fill them. So the demand has softened a little bit. Again, we don't know how big a pool will arrive on the 19th. I imagine it will be difficult for people at first to get an appointment. And so that's why I am saying that if you're young and healthy and you're 25, maybe you should wait a little bit, let other people who are a little bit older get vaccinated first, and then take your turn later.
Do you have an updated timeline for when all of Philadelphia will be vaccinated?
We put out projections. I probably need to update them. It really is going to depend more than anything at this point on how many people ultimately want to be vaccinated. I think vaccine probably will be available. Everyone probably could be vaccinated by the end of June. But how many people will choose to be vaccinated by the end of June is very hard to predict.
And you talked a little bit about more infections translating into more hospitalizations. Why isn't there also a rise in deaths like we saw in many of these other waves? Is there something different in respect to this wave versus the three previous ones?
Well, a couple things. First, there's a lag time between when people get infected and when they die, if they do die from this. And that's about 3 weeks. And then there's another lag time of about 3 weeks for us to hear about all those deaths. So it may simply be that we don't know yet about the deaths that have occurred with this wave. Alternatively, it could be that the vaccine isn't preventing those deaths. And so I'm watching that number very closely. I'm looking at the ratio of cases 3 weeks ago to deaths this week. And if that ratio is high, then that's a sign the vaccine is working. And it's just too early to say.
Thank you very much, sir.
All right. Thank you, Mitch. Let's go to David Melandra of Philly Sports Network.
My question is for Dr. Farley. A couple weeks ago, you mentioned that you would not match the state of Pennsylvania regarding the attendance for indoors and outdoor events. But over the weekend, the Phillies increased their attendance, and the Flyers and Sixers are also doing the same thing. Can you just give us an idea what led to the increase with that?
Yeah, so we had discussions with both the people who are at the Wells Fargo Center and as well as the Phillies about their safety plans and about specifically how many additional people they could put in their stadiums and still have a safe distance between the one household group and another household group. And having looked at that, we felt that we could, it was not safe to go to the occupancy limits that the state allows, but that we could allow a small increase in occupancy. And so we did allow the the Wells Fargo Center to go from 15% to 20%, and the Phillies to go from 20% to 25%.
Okay, and this is a follow-up for Mayor Kenny. With everything going to be happening on April 19th, everybody will be able to get a vaccination and everything like that, appointment for a vaccination. Have there been talks about with the Eagles about using Lincoln Financial Field for like another vaccination unit?
As from the first time we talked about this, Lincoln Financial Field's potential as a site has to do with the amount of vaccine that we can provide. It's a mass vaccination site, so if it would do at least as much as the convention center at 6,000 or so, those 6,000 doses had to come out of the city stockpile of doses, which means there'd be 6,000 less people in underserved neighborhoods getting it. So unless and until we get a large amount of vaccine from the federal government's tranche, we're going to have to hold off and continue to get into neighborhoods at the 500, 1,000, 1,500 people per day. There's many neighborhoods in the city who are underserved, and if we were to divert 6,000 or more vaccines to the Lincoln Financial Field site, we'd be shortchanging people in the neighborhoods.
All right, thank you.
Thank you, David. Let's go to George Solis of 6ABC.
For Dr. Farley, good afternoon. So going back to the convention center site, after the next 2 weeks of Pfizer and then the shipment over to Johnson & Johnson, what remains the future of that site, and will there be more walk-up eligibility at that site once once the change is over?
So we have one more week of Pfizer second dose to do, and then we are scheduled to have 2 weeks of Johnson & Johnson availability. That will complete the 8 weeks that was originally planned for the site. We are in discussions with the federal government now about whether that would be extended. That would depend on the availability of the personnel as well as the availability of the vaccine. So we don't have an answer on that yet. So all I can do is guarantee that we'll go out for 2 additional weeks after we finish the second doses for Pfizer, and that we hope soon to know whether we can extend it.
As far as the site in Esperanza, will that strictly be Johnson & Johnson, or will there be an allocation of Pfizer and Moderna as supplies are available?
We need to supply that site with vaccine. That doesn't come with its own vaccine. I tell you, the Johnson & Johnson vaccine that we received this week, that large amount, is enough to be able to cover us for, we think, 2 weeks at that site. And so that's how we plan to start. But as to what vaccine will be available and when we phase it in others will really depend on availability of vaccine in the future.
George, you good?
I'm good, thank you.
All right, thank you, George. Let's go to Jack Tomzik of Metro.
Yes, thank you. And this is for Dr. Farley. Last week, you said you were a little bit concerned with moving to vaccinate all adults, or at least allow them to set up an appointment on April 19th. You mentioned that it could leave seniors, maybe other vulnerable people behind. What changed?
The president asked everybody to move to April 19th, and the president has provided great leadership on this. And when he asks, I think we ought to do what he asks.
And are you worried, though, that young, healthy, tech-savvy people will kind of overwhelm the scheduling system trying to get appointments?
I do worry that young people will get in, and it may be harder for people over the age of 65 to get in, which is why I'm asking all the sites to set a priority for people over the age of 65, and asking younger people that maybe you should wait a little bit and give those other people a chance to be vaccinated first.
And for the Esperanza site, you said it'll be open 6 days a week, but do you know what hours that'll be and whether there will be some walk-up availability, and how, what the breakdown will be between walk-up versus appointments?
And the hours will change day by day. We want to have some off hours so that people who are working 9 to 5 have an opportunity to be vaccinated there. And it will be available both through a combination of appointment and walk-up. We've learned that some people, an appointment is a barrier, and so we want to give them walk-up access. But for other people, an appointment is an easy way to get in. So we want to have that combination.
Great. Thank you.
Thank you, Jack. And let's go to Max Marin of Billy Penn.
Hi, thank you very much. Dr. Farley, just wanted you to clarify the discrepancy between the CDC data and the city data in terms of residents who are getting vaccinated outside the county. Is it that the CDC is measuring that and the city is not?
And so we collect data on everybody vaccinated in the city of Philadelphia in our immunization registry, and we send that to the Centers for Disease Control. The state of Pennsylvania likewise has data on everybody vaccinated in the other counties, and they send that to CDC. So a Philadelphia resident who's vaccinated, say in Montgomery County or Delaware County, we won't have that data, but the CDC will have that data. So I can report on the Philadelphia residents vaccinated by the city of Philadelphia, but that's going to be incomplete. When it goes to the CDC, it's combined with the data of Philadelphia residents who are vaccinated elsewhere.
Gotcha. Okay. And a couple of weeks ago, you had mentioned that Philadelphia is sat somewhere in the middle of other U.S. cities in terms of its vaccination rate right now. What has changed? Are you still monitoring other cities and where we stand?
I haven't looked at it in over a week, but the last we looked at it, as far as the number of doses we're delivering per capita, we're right on par with other big cities. But if you look at the percent of our residents who are vaccinated, it's lower because we're vaccinating a fairly large fraction of the folks. In fact, a fairly large fraction of the folks that we're vaccinating are people who don't live in the city of Philadelphia. And so that lowers the number of people in the city who are vaccinated.
Fair enough. Last quick thing, you had mentioned that you had tested out the system yourself. Were you saying that you had been vaccinated recently and tried out the registration process?
I haven't got the vaccine yet. I'm scheduled very soon, but I decided to test it out to see how difficult it was for somebody over 65 to get an appointment.
All right. Thank you so much. Good luck.
Max. Let's go now to Martin Pratt of Philly YBN.
Hey, Dr. Farley, can you explain a little bit more about the young people and asking young people to wait? Because from what I understand, the numbers are, this is disproportionately affecting people in their 20s to 30s. So you're asking them to not get vaccinated and let people in their 60s, and we see the numbers going down?
Yeah, so I can understand why you had that question. People who are in their 20s and 30s are probably more likely to get infected, but they generally don't die from this infection. They do very well with this infection. On the other hand, people over the age of 65, if they get the infection, have a serious risk of dying from it. And we vaccinated right now, 25, 30% of the city. That's not enough to change the overall trajectory of the epidemic yet, I don't believe. And so over the next 3 weeks, next month, how do we prevent the most deaths? To me, the best way to do that is to vaccinate the people who are most likely to die from it. We can do that in the next 3 or 4 weeks. Then we can be more open and vaccinate those folks that might reduce the number of new cases. So it's just for a short period of time now. We just don't want to make it hard for anybody over 65 to be vaccinated.
Got it. And another question. The variants can you tell us how many of the variants have we seen? All the variants here in Philadelphia yet, or we're only seeing one or two of the variants?
We have seen the B117 variant. That's the one that arose in the United Kingdom. We have seen the New York City variant, which I forget the exact number for that. We have one case of the South African variant that has been diagnosed in Philadelphia. So they're all here. And the fraction of the viruses circulating in the city that are the B117 of the New York City variant is high, and it's growing fast. And so I would say increasingly that the variant is playing a role in driving up rates right now. I don't know how much of that's causing the increase versus people just traveling around more and exposing other people. But that variant, I would definitely say, is playing a role. Fortunately, the vaccine protects against these variants as well. So we still have the right approach, and that is to get people vaccinated as quickly as possible.
Thank you. And you left us kind of hanging. You said you went through the process, but you didn't tell us how the process was.
Oh, the process worked very well. So I put my name in the city's database. I put my name in a database for where I get my health care. And within an hour, I had an opportunity to schedule an appointment with my healthcare provider. And within 4 hours, I got a phone call to schedule through the city's database.
Thank you.
All right. Thank you, Martin. Let's go now and wrap up round one with Laura McChrystal of the Inquirer.
Hi. First of all, Dr. Farley, could you clarify the opening date for that Esperanza site? You said next weekend, and then I think later you said this weekend. Could you give us a date? All
right. If I said next weekend, I misspoke. It's this weekend. On Friday, we're going to be having a press conference there. We'll be vaccinating about 1,000 people. So consider that like a soft launch, and then we'll be increasing the number after that.
Thank you. Also, the planned closing of the convention center FEMA site, if that does close, would that have an impact? That's a large number of doses that they do. Would that impact or push back your idea that everyone could be vaccinated by June, or what kind of impact would it have?
Well, we'd certainly, we would want the site to be able to stay open. That would require, again, the personnel and the vaccine. And it would be a setback if we could not extend it. I still think that we could probably get there at the end of June. I'd have to look more closely, but I think we could probably get there without that site. But the sooner we vaccinate people, the better, especially with case rates rising as they are now.
Okay. And lastly, are you in discussion with FEMA about opening any other sites, whether another type 1 or type 2?
We're always in communication with FEMA. There's nothing that's imminent, I can say.
Okay, thanks.
Thank you, Laura. Let's move on to a second round of questions, and we are able to expand to other topics. Let's go first to Rosemary Connors of NBC 10.
Hi, thanks for that. This question is for Mayor Kenney. It's somewhat related to the pandemic, but more specifically related to the shooting last night just outside of Budokan near 3rd and Chestnut Streets. I reached out to Stephen Starr, who had a comment about what happened, and this is what he said. And I did share it with your press office, but I can read it again just so you have it. He said, "It feels that the government is leaving the economic epicenter of Center City to fend for itself. I have never seen it this way. The proud entrepreneurs are valiantly trying, but we need basic support and protection from our mayor and police force. Ed Rendell rallied us all and reminded us how great this city could be. We need that optimism and leadership right now." What's your reaction to that statement from Stephen Starr?
First of all, violence or homicide in any part of the city is as important as any other part of the city. So the fact that someone tragically was killed at 3rd and Chestnut is no more important than someone being killed in North Philadelphia or West Philadelphia. They're all human lives and they all have the same value. Ed Rendell was a great mayor, was a great governor, is a great person. Ed Rendell was not dealing with a pandemic and a proliferation of gun violence that we've never seen before, as we've seen in every other city in the country. So every city is going through this. We're working on our roadmap, our upgraded roadmap to get the violence down. Our police are valiantly working every day to get guns off the street. We've taken twice as many guns off the street this year than last year. So they're working very hard. We went through a pandemic that shut down the criminal courts, shut down probation and parole, shut down social services being delivered directly to individuals who need it, who are in jeopardy or in danger of either shooting someone or being shot. As we roll out of this pandemic and get our systems back in order, the violence will go down, and we'll get back to some sense of normalcy. It's easier to get a gun in Pennsylvania than it is to get a driver's license, and that's one of the big problems that we're dealing with. So we'll continue to forge forward. I'm sorry he feels the way he does, but we're moving forward.
Do you think that this gun crisis will get under control at some point soon? I mean, I hear you say that hopefully the crime will go down.
No, not hopefully. The crime will. I didn't say hopefully. I said the crime will go down, and it is a crisis because we're dealing, as I said before, with a pandemic, with a dysfunctional court system, dysfunctional probation and parole system. Those are all starting to come online again, and we'll get people back into systems that reduce the violence and get people more under control. And if we can continue to get the guns off the street, which is what we're doing every day, we're working towards getting that done. So it's not a hope. It will happen. It's just a matter of time till we get it done.
Thank you.
Thank you, Rosemary. Let's go now to Hannah Chin of WHYY.
Hi, thank you so much. So my first question is actually, when exactly will the vaccine appointments be available to schedule? I'm wondering if it's a situation where they'll open at midnight on the 19th for the FEMA site, and at pharmacies, is the city going to email out those locations? Will CVS schedules be open basically right away? Or is it something where everyone will kind of be waiting and it'll roll out to the most high priority groups in phase 2? Kind of how will that work?
So there are appointments available across the city at all times now. So, if you put your name in our database, you will be called and emailed and say, here's an opportunity to schedule an appointment, and you can schedule those. If people want to get an appointment specifically at the Esperanza site, again, they should put their name in the database. And when we open up that appointment, those appointments, which will be sometime probably in the next couple of days, then people can schedule those appointments there.
Okay, and they'll get a notification from the city, email, link, etc.
Yeah, so if people put their name in our vaccine interest database, when we notify them, they get an email, a text, and a phone call. So we do everything we can to reach them.
All right, and pharmacies will also be open to everyone starting the 19th?
Yes.
Okay, great. And then my second question would be around you're encouraging younger people to wait. I was wondering, do we have information on how many older people have been vaccinated? Basically, how are we expecting those younger people who are possibly healthier, maybe don't need to be prioritized for the vaccine as much? How are they meant to understand when they can get an appointment without taking it away from someone else?
Oh, anybody can go to our website where we have a dashboard and we show the percent of people that are vaccinated by age group, and people can get a sense for that. And then it's something I'll talk about at our press conferences weekly too.
All right, I understand that. I guess I'm wondering, when you're saying, younger people should wait a little while, how are they meant to understand how long they should wait.
How long they should wait. And I wish I could say, well, wait 2 weeks, and then we're going to be done. I think we're going to have to monitor how in demand the appointments are. If we're finding that there are open appointments, then I can say at a press conference, okay, our appointments are open. Everybody come on down now. If I say, look, there's a long waiting line, and many people we just simply can't accommodate, then they should probably wait a couple of weeks.
Got it. Okay, thank you.
Thank you, Hannah. And let's go now to Denise Clay Murray of the Philadelphia Sun.
Good afternoon, everyone. My question is for Mayor Kenny, and it's kind of a follow-up of the one Rosemary asked. You say that, right now we're following the roadmap in terms of the city's gun violence problem. Where does that stand exactly? Because you have a lot of folks who would kind of like to see more from the city on this regard. Where do we stand with the roadmap?
The updated roadmap will be released next week. We waited because we were waiting to see what resources we would be getting from the federal government in assistance and the introduction of the budget for next year. We wanted to do it all together. So I think on Wednesday, the new roadmap or the updated roadmap will be released, and we will move forward with that framework.
Now, is that this coming Wednesday?
Wednesday before the Thursday introduction of the budget, which would be next Wednesday.
Okay, but can you understand why folks might be a little frustrated, especially when even over the summer you had kids who were sitting on their front porch getting shot while they were playing, and now you have this thing that happened in Old City last night, and I understand that you believe that everyone is equal here, but can you understand why folks might be a little frustrated?
I can understand why people would be a little frustrated, but I can assure you I'm a lot frustrated because we deal with this every single day and every hour of the day that we deal with it, through the day and through the night. So we are working on it. Our police are working very hard. We're working with our social service folks. We're working with people in the community. We've issued a large number of grants just recently, and we'll be doing that for people to get on the ground and get with these young people and to try to get them to a point where they understand they need to put the guns down and that there's no future in violence or in death. So, yeah, I understand their frustration. I share their frustration probably even more than you know.
Okay, thank you.
Thank you, Denise. And seeing no further questions, we will wrap up today's press conference. We will resume with the next regularly scheduled COVID update on a week from today, Tuesday, April 13th. Thank you.